chapter 2 of our trigger point book. It goes over chi, movement, and health. So we're going to talk a little bit about Eastern Western medicine and the merge between them. So Eastern medicine would be your traditional Chinese medicine, TCM. This is primarily based upon internal medical model, so body as a whole, right? Wellness as a whole. This uses herbology alongside acupuncture. So meridian acupuncture is acupuncture based on the body's meridians. So remember, we've gone over how Eastern medicine believes in meridians through the body. All these meridians are energy sources. And if there is dysfunction, there's usually a stagnant area in the meridians. So meridian acupuncture would go along those to kind of balance the body so that your chi or your life force energy can freely flow. If you don't have freely flowing energy, they believe it often results in dysfunction or disease. The Western approach uses more medications and surgical intervention to treat dysfunction. So just think of the U.S., they just want to give you pills. The pharmaceutical companies are profiting off of how we treat dysfunction. Then you have the merge. So this could be your myofascial meridian therapy, or I would say that massage therapy would be in this merging section, right? So we can work alongside allopathic doctors, right? But also treat our clients naturally. So, myofascial meridian therapy is a form of treatment in which addressing a patient's pain is done within the context of treating the person as a whole. So we're trying to find why there's dysfunction. Not us, but whoever, whatever doctors or services the client might be trying to receive to, fix them as a whole. We're not really fixing, but you know what I mean. The movement and chi. So movement is the fundamental characteristic of energy or life, right? When health requires your movement, or health requires movement. Sorry, I'm saying it all weird. And then when your movement ceases, life ceases. So movement is life, right? Warmth is an indication of the existence of chi. So a living creature will have warmth to them, unless they're like reptile amphibians and they're cold-blooded. But a lot of times warmth is indicated by the existence of life force energy. Fascia. This is your bandage or your band. So remember, I also say it's like a spider web throughout your body, just connecting everything. So everything in your body is layered with fascia, right? Especially the muscle groups and the organs, to kind of keep everything in their compartments. So fascia exists as a single continuous sheath that extends from head to toes and encases every organ, muscle, and muscle fiber. So you have your superficial fascia. This covers the entire body subcutaneously. And then you have your deep fascia. This lines the body wall and the extremities. So here's a picture over here of your superficial fascia, right below the skin, right? And then you have your deep fascia that is deeper below that. So it is, encasing this muscle wall, right? And then also you have your deep fascia deep within the organs and such. Superficial, again, covers the entire body subcutaneously. The outer layer contains fat. The inner layer is thin and elastic. Between layers, you will find arteries, veins, your lymphatic system, mammary glands, and facial muscles. So remember, your facial muscles aren't very thick. They're primarily used, with the exception of some, for mastication, but primarily they're used for expression. Deep fascia. This lines your body wall and extremities. This holds your muscles together, separates them into groups. It allows for movement, support, stabilization. It carries your nerve and blood vessels and fills the space between your muscles, or else they might become injured. Say, you can get injured anyhow if there's an external force, but there's less movement if it fills the space, right? So it's kind of like a cushion as opposed to pushing on a balloon full of air. It sometimes provides muscle attachments as well, and it facilitates your blood and your lymph circulation. So you need to move for your lymph and your blood to circulate optimally. That's why you'll notice sometimes if you're laying around more, or you'll even notice some people who are more sedentary, they can get swelling in their feet and ankles, and that is because there's no movement going on to bring the lymph out of that area or to keep the lymph from pooling up. Myofascial treatment. So treatment of the skin, muscle, fascia, and adipose tissue, which is fat, opens constrictions and promotes the movement of all bodily functions and activities. So easing myofascial restrictions can improve your circulation, right? Lymphatic drainage, nerve conduction, this is a big one, and organ function. We're continuing. We are going to talk about the somatovisceral reflex connection and the viscerosomatic reflex connection. I have a little note on the bottom. It says, remember, soma means body. All right. So, somatovisceral. Break down the word. It's not that scary. So, body, organ. Visceral is organ. So, this is a muscular disruption that alters the ability of related visceral organs to function properly. All right. Myofascial constrictions may result in tachycardia, so your increased heart rate, chest pain, tightness, diarrhea, vomiting, food intolerance, and so on. Now we have the opposite. All right. First was a muscular disruption. Now we have a dysfunction of the myofascial area, or myofascia, there's no L there, resulting from disease or dysfunction of the related visceral organ. So one starts with the body to the organs, and the viscerosomatic starts from the organ to the body, right? So read the word, and it tells you which is first and which is second. Hope that makes sense. Clinical treatment, bowels. So there is abdominal massage, right, to help with the function of your bowels, your small or your large intestines, right? IBS or other bowel issues, you can massage, or now this is not in our scope of practice, but people can do dry needling or even acupuncture, which is basically the same type of needle, just a different technique, right? So if we are massaging the bowels, we're kind of hitting those rectus abdominis and external obliques, right? Now this is, unless you guys are really interested in Eastern medicine and study it, there's different meridians that are being stimulated, say with the massage, acupuncture, or acupressure. So this would be your Han-Tai Tang, I'm probably saying this all wrong, your small intestines meridian, or your Han Yang Ming colon meridian. So those meridians during the acupuncture or acupressure would be stimulated to kind of stimulate the bowels to function properly. For us, we're just going to do an abdominal massage. And that is it.